was heated by the first images of your platforms. Since for the first time I saw navigated on the internet, and I thought, okay, this is my system. I think that these platforms are very useful not only for training with the maneuvers, with the technique, with the technology, but they are also useful in order to understand how to manage complication. In other words, what I was hinted before of all was the possibility to check the position of the tip with the thermal sensor in order to avoid to be very close to the nerve, because we know that one of the most important complications is the damage of the laryngeal nerve, inducing the palsy of the vocal cords with the voice change. And the thermal sensor in this system is very useful in order to understand how close I can stay, but not so much to be safe, because safety is the first important thing that you have to take in your mind every time, to be safe, because these are minimally invasive technique and they need to be safe, okay, because we don't do surgery. Surgery can be aggressive in some cases, but for benignity we don't need to be aggressive. We have to remove the problem. What's the problem? Compression. Okay, we reduce the volume. We don't need to remove everything. And with this model we can do this. We can observe everything and be safe, really safe.
So Dr. Mauri, can you also share your thoughts on or your experience on using our platform versus how you do it, your training before?
I started an MITT adventure also with Dr. Spiezia back in 2018. And we did some training during our meetings, and we were using like chicken or homemade phantoms that were, let's say, quite good, but very tricky to organize and not very realistic. Since the last courses, when we started using this kind of model, I have to say that the result is by far better. It's more realistic, also involved people are happier, they really like using this. Training is also, let's say, faster, because it's quite quick to have a new nodule, to change everything, while with a homemade one, it's more, every time, much more complicated, also for us when are organizing the meeting. So I think this really improved the quality of teaching and of learning.
What is really important with this platform that you cannot only be skilled with the technique to understand how to move the needle also, but how to apply the right protocol. Because to be safe, independently from the energy that you use, the frequency or microwave, you need to be safe using a protocol such as moving shot technique. Because with this technique, with thousands and thousands of procedures that were done, okay, you are sure that this technique will be the most safe you have to treat the patients. Okay, it's the safest way to treat the patient. So it's important to understand that you can well see the anatomy, but also you can understand how to move and how to apply the best protocol to be safe and effective, because the results depend from these two factors.